Hey guys, we're almost done with phase 2 of remote learning. So when we go and we look at week 3, last week we got 2 things coming up for this week. Starting on the second part of unit 7, which is going to be on like surgery packs and surgical prep. We're going to go over the notes today for slides 29 through 43. And we will have one assignment and one thing for you to kind of like one very detailed handout for you to go through and look at. Jumping right into the PowerPoint, we do have a few videos that we're going to be watching to help kind of supplement what we're not really able to do in the classroom so that you're able to see more so what I'm talking about. First thing is going to be on gloving. There's 2 different types of gloving techniques. There's open gloving, which involves picking up the gloves and putting them on so that the outside of the glove doesn't contact the skin. So that you're only touching like the inside of it. And then there's closed gloving, which is going to happen when the vet already has on like their surgical gown and they don't really have their hands like all the way out. So they put the glove on over so they can just stick their hand in, and that way the skin doesn't have to contact the gloves at all. So I'm gonna pull up this video. Just gonna watch her, make sure she's thoroughly cleaning her hands. Close gloving. Okay. So this video, so that's what I got. We're gonna watch a video in a couple of slides, and it does a much better job of showing closed gloving because it's actually a vet in a surgical gown, finishing up by putting on gloves via the closed method. Gown packs contain the gowns used for surgery. They have to be opened in a way to try to make sure everything is completely sterile. So opening them like away from you, always opening outward, never inward, trying to not touch anything on the inside, and only touching the outside. And these gowns, they'll be packed in a way that you're only going to be touching, like they're going to be packed in a way so that you can maintain sterility. And when we watch the video of the vet putting on the gown, he'll kind of like very briefly hit on packing gowns so that you're not gonna cause any kind of cause any kind of infections. Okay, so we're actually gonna hit on that now. So gowning the surgeon and the assistants for surgery, put on the mask, the cap, the hair cover, the boot cover, like everything. Put on the surgical scrub, or perform the surgical scrub. Dry your hands, put on the gown, then put on the gloves, and then the assistant will tie the back of the gown. So essentially, this is kind of like the steps that everything is going to have to be done. So this video, I think, is a bit louder. So I'm gonna pause real quick, just to kind of make a note if you didn't see it. Notice the two different colors between the outside of the gown versus the inside of the gown. Where the assistant is grabbing it, she's touching the inside. She's not touching the outside, so she's maintaining that sterile field. This is a way better video. So this sterile card was actually also, when he was putting on the gloves, this is that same sterile card. So when he initially put on the gown, the ties are already like that with the sterile part up there. It got sterilized with the gown pack so that when it's time to put it on, it's there. Okay. So that's kind of, as he was putting on that, as he was putting on his gown, he already had on the mask, the cap, the hair cover, and we didn't see the boot covers, but they were probably there too. He had already done the surgical scrub and dried his hands. We watched him put on the gown, then put on the gloves, and then tie the back of the gown. Talking about sutures and different suture types. There's two different types of sutures. You can do absorbable or non-absorbable. And the suture types, or which one you're going to end up using, is going to depend on basically like what the animal needs and primarily where the suture is going to need to be placed. Absorbable is going to be able to be broken down by the body, and you're typically going to put that somewhere that's going to have like a quick heal time. It doesn't have to like endure a lot. It's not in a place that the body like bends a lot or has a lot of stress put on it. It's going to easily heal up. Excuse me. Absorbable, typically the sutures, depending on what type you end up using, they can last anywhere. The Vicryl Rapid is going to be like in the process of being absorbed after 2 weeks of being put in, whereas the monocryl is going to last like 4 months. The absorbable, they're going to get broken down and they're going to start losing like that strength to really hold things together about midway through of whatever their life is. The reason you would use a non-absorbable suture is going to be because it's somewhere that is going to be moving a lot. It's going to have a lot of pressure exerted on it, a lot of movement, and you're going to want it to be able to withstand that. Or it's going to be somewhere that's going to take a long time to heal, like a part of the body that takes a while. This is going to be like an intestinal suture that is all, you don't really have much control over it, and it's going to take a while to heal. It's typically where you're going to see like the non-absorbable sutures. These can take anywhere from like 1 to 2 years, and they can just sit in the body. The silk suture type, you can actually, the body will slowly absorb it if need be. But that's going to be like 2 years of you with sutures. But primarily, like, just the reason you're going to have to pick is going to be like where the suture is going to have to be and how much pressure it's going to have to be able to withstand. I put these 2 links in here, and they kind of go through the different types of sutures, the pros, the cons, their shelf life, if that's what we want to call it. We're getting into some surgical instruments that are commonly used. Scalpel blade and scalpel handle. They are 2 different technical pieces of equipment, but you've got your sharp end piece that's going to be used to make an incision. It kind of acts as like a surgical knife. You've got a clamping forceps. The clamping forceps is used to clamp down, it can be used to like clamp the drape, or it can be used to like clamp down to help control blood flow during a surgery. Basically, you shut it. It doesn't need to be moving. It doesn't need to be like loosening up. It needs to stay exactly where it is closed. Needle holders, needle holders are going to hold the suturing needle for when wounds are being closed or during surgical suturing. They literally hold a needle. So like when you watch the suturing videos and you're going through, that's what's going through and holding the little needle and pulling it through while they're stitching up that animal. Tissue forceps, they are non-tooth forceps, and they're used for like fine control for holding tissues and maintaining traction during a dissection primarily. Hemostatic forceps are used to prevent any kind of blood flow from an open blood vessel by, again, compressing and holding there and not loosening up. Intestinal forceps used in the intestines, and they firmly grasp like any kind of intestinal tissue during a surgical procedure. Hold it, to move it, whatever is needed. There's tons of different kinds of intestinal forceps. And scissors, there's also quite a few different kinds of scissors depending on what you're going to use them for and what you're going to need them for. Scissors for cutting bandages, for cutting through skin, cutting through intestines, dissecting, like very different ones that you can use for different things. A retractor is going to be kind of like it opens up something. It's almost like reverse scissors, really. When you shut down, it actually opens up the end. It can be used to like open something like an animal's mouth. It can be used to like open up a part of their body. If you're performing surgery and you need to get organs out of the way, then it can be used to move those organs up and out of the way so that you can get to whatever it is you need to be working on. And then the spay hook is going to be used when spaying an animal, so during an ovary hysterectomy, to grab the horn of the uterus and pull. So literally kind of like a sheep's hook or a shepherd's hook. So we will pause for a second. This is going to be where you're going to go through and you are going to have to go through the PowerPoint and describe what each piece of equipment up here describe what each piece of equipment is going to be used for. And then determine what equipment is going to be monitored by like you as the assistant or by the doctor. Primarily though, I just want you to focus on the description of each piece of equipment. So moving on to surgery pack prep. This can be kind of a lot of information. So a surgery pack is literally a pack of things put together, sterilized, like good to go, everything you're gonna need for X surgery that's being performed. You're gonna have some non-sterile items and some sterile items. Primarily everything is gonna be sterile because you need it to be. Things that aren't going to be considered sterile, the hair cap or cover, the mask, and then the booty. So basically everything up until that surgical scrub for when we were talking about gowning the vet. The things that are put on before the surgical scrub are not considered sterile because they weren't put on with clean hands. The sterile items are going to be the scrub pack for cleaning, for doing the surgical scrub, the linen hand towel for drying hands off, actual surgical scrub, the glove pack that has the correctly sized gloves, because obviously it's kind of hard to work if your gloves are too big or too small. And then the sterile gown pack, which is what the vet was putting on. Things that are going to need to be sterilized separately are going to be the instrument packs. So having all those, whatever the instruments that are going to be used, all those instruments going into the autoclave, sterilizing them. Make sure they're all clean the way that they need to be, and that autoclave tape says so. The half surgical drape and the quarter surgical drape, both sterilized. These are essentially like two different sizes of surgical drapes, depending on what size that you're going to end up needing. The towel packs, because you got to have clean towels. The individual instrument envelopes are also sterile, and then possibly any bowel packs. So packing a surgery pack, you're definitely going to need gauze sponges, a laparotomy towel for when they make that, like if it's going to be a surgery that's going to require the animal to be opened up, then you're going to need that laparotomy towel. The suture materials for whatever kind of material you're selecting, absorbable versus non-absorbable, the silk versus the Vicryl, like the suture material needs to be in that pack. And then the surgical blade. The scrub pack is going to include a hard bristle brush, sterile hand towels, the surgical scrub, and then the surgery gloves, so they can be put on right after those hands are dried. Hands are clean, now it's time to put on those gloves. This video is on assembling a surgery pack, so not a scrub pack, but like the actual surgery pack. It is a little bit on the longer side, but it does show you like all the things that go into a surgery pack. There's more than you think. So pausing real quick here, you can see in this close up, like there's at least 1, 2, 3, at least 3, maybe 4 or 5 different types of forceps just right here. All right. So, kind of a longer video, but very, very helpful. So you've got the instrument packs that are in there, the half drape and the quarter. The half drape is the larger, and then the quarter is going to be that last little small one that we saw. We saw the gauze sponges, the suture material, surgical blade, all that stuff. Then I want you guys to look at, this is kind of a lot. This is just kind of a lot of information on surgery pack, surgery wrapping. It contains the do's and the don'ts, and it has a lot of like really helpful pictures. Tells you about like how to cut drapes, if you have to like make your own drapes, how to fold them, because you want to fold them accordion style. So basically, like, you want to fold it over, and then you want to fold it under, and then you want to fold it over, and then you want to fold it under, so that it kind of layers itself together. Then it gives you some like common surgical packs. You can see these called like list packs, recipes, and it just tells you like how many and what different things need to be included in a pack. So this is a recipe for a canine spay pack. So you're gonna need 4 towel clamps, 4 of these, 1 scalpel handle right here, 1 red or brown needle driver, so right here, 1 blue and black thumb forceps. So it just goes through and it tells you all the different things you're going to need to perform a spay on a dog. And then any additional items. You're going to need a drape. You're going to need autoclave tape. You're going to need some gauze. So just so you can see like how many different things you're going to end up needing. You can see like all the different kinds of scissors that are going to be needed. You can see like different forceps. Pediatric spay, so spaying a young animal. Neutering. You can see you don't really need a whole lot for a cat neuter pack. Equine hernia, so a horse with a hernia, horse crypt pack, processing your pack, so like putting it together. We saw in the video she counted her supplies. She had everything she needed. An orphanage is just a place for instruments that they had been like lost or misplaced. So if you're like, oh man, I need like 2 more pairs of forceps, I don't know why I don't have them, you would go and check the orphanage to see if those 2 extra pairs of forceps were there. Make sure everything is clean. Package anything separately that might need to be packaged separately. Put everything up there. I really like this guide. It seems a little bit overwhelming, but it's really helpful because of all the pictures that it has. Takes you through the steps, how to go through and wrap it. I really like the video of the woman showing us how to wrap that surgery pack, because it's easier for me to watch the video than it is for me to look through these pictures and try to figure out what exactly that they did. You can see like the envelope style, always leaving the little tab. Then it tells you about gown folding. So just look through that, a lot of helpful information. Then if you want, I thought it would be kind of interesting, since we can't make our own surgery packs at school, I thought it would be cool if you try to like make your own surgery pack recipe at home. So like this is the recipe for the canine stay pack that we just got out of that document. You could like make your own recipe, and it obviously doesn't have to be for vet stuff. It could be like the colors you need to paint a specific picture, kind of like how like a color by number. It could be like makeup put on, like 1 eyelash curler, 2 colors of eyeshadow, 2 shades of foundation, like so on and so forth. And it could be like 2 shades of brown and pink glitter eyeshadow, something along those lines. It could be the ingredients, like an actual like food recipe, like 4 ounces of this, 2 cups of that. I mean, it could really be anything. You're basically just making a list and making sure you have quantities up there. And then you can practice wrapping it if it's something you can wrap. If it's a recipe, probably not. If it's not something that you can wrap, then you can try like just wrapping a shirt and then getting like a bath towel and a beach towel or something like that, and then like using those to practice that wrapping technique of like getting the corners and making sure the edges are pointed outward. Maybe something interesting to try since we can't really be together to do that. That's all. I will upload another lesson on Thursday for you guys. Let me know if there's anything I can do for you. If you try doing the surgery pack wrapping or the recipe list, let me know how it goes. I want to see it. Want to see what you guys put together, how creative y'all get. But let me know if there's anything I can do for y'all. Miss you guys. Hopefully I'll get to see y'all soon, but take it easy.